Accurate medical coding is not about memorizing codes. It's about understanding the underlying concepts. It is about using the correct manual correctly, every time. The golden rule: index first, tabular always. Across all three code sets, your safest habit is to start in the index to locate the likely code range. Confirm in the tabular to verify you have the correct code, correct specificity, and all required instructions. Apply guidelines and notes. Never code from the index alone. The tabular is where the real rules live. Identify what you are coding. Diagnose conditions, symptoms, and circumstances that justify medical necessity. Clarify the provider's documented diagnosis. Read the encounter context, such as initial versus, subsequent versus, sequela, acute versus, chronic, current versus, and history. Required specificity, such as laterality, anatomical site, episode of care, severity, complications, trimester for OB, stage for neoplasms, and organism in infectious disease. Use the index to locate the condition by the main term, such as diabetes, pain, fracture, or an infection. Subterms for site, type, etiology, or manifestation. Cross-references, such as C, means you must look under a different main term. C also provides additional options to consider. Go to the tabular to confirm the correct category/subcategory and required characters. Laterality, right, left, or bilateral. Need for the seventh character. Placeholder X usage when required to reach the seventh character. All instructional notes, including excludes 1, mean that they cannot be coded together. Excludes 2 means it may be coded together if appropriate. Use additional code. Sequencing and combo coding rules. Include notes. With guidelines, conditions linked by with in the index are presumed related unless documentation states otherwise. Validate sequencing and medical necessity. ICD 10 CM code order matters. Confirm. Principal diagnosis for facility or first listed diagnosis for professional rules. Etiology, manifestation, and sequencing when applicable. Whether the documentation supports the level of specificity required by the code. The CPT index helps you locate codes by procedure or service name, such as a biopsy, repair, or injection. Anatomic sites such as the shoulder, knee. Conditions such as a fracture. Eponyms and common terms. The index points you to a specific code range, or guideline section. In the tabular, confirm the full code descriptor, parenthetical notes that guide use, bundling, add-on eligibility, or modifier requirements. Guidelines at the start of sections, subsections. Whether a service is a standalone code. An add-on code must be reported with a primary procedure and never appended with modifier 51. A code that requires a separate report or additional documentation elements. You must select the correct approach, such as open, laparoscopic, endoscopic, or percutaneous. Also, laterality, if applicable. The extent, complexity, such as simple versus intermediate versus complex repair. Lesion size, number of levels, and number of units. Included components, global surgery package concepts. Watch for CPT rules that drive accuracy and production. High-performing coders build these CPT habits. Check for bundling guidance. Confirm separate procedures rules when a code labeled separate procedure is reportable versus included. Confirm global period implications, such as post-op visits, not separately reportable in many cases. Select the correct EM level using the current CPT EM framework, MDM or time when appropriate, and verify add-on codes when applicable. Use the HCPCS index to locate the likely code range. Common supply or equipment name. Drug names. DME descriptors such as wheelchair types, braces, oxygen, etc. In the tabular, confirm the full descriptor and any included components. Units of measure. Common error point for drugs and supplies. Required details such as route of administration for drugs, concentration strength, and billing units. DME type features. Required modifiers, especially for DME pose and certain supplies. A repeatable workflow that improves both accuracy and production.